Dr. Mallika Marshall is here with us as well. Hi, Mallika. Nice to
Katie.
see you. So tell us what causes congenital insensitivity to pain, what Ashlyn has been diagnosed with.
Yeah, so it's a condition that is caused by genetic mutations that actually prevent pain nerves from being able to fire properly. So normally if you get a noxious stimulus or something very painful in the skin, for example, very quickly a signal is sent to your brain saying, ouch, that hurts, don't do that.
Right.
Well, in patients with this condition, they don't get those cues. So if you and I were to touch a hot stove, for example, we would immediately recoil because a signal would be sent to our brain saying, don't do that, you're going to get burned. Or if you touch something sharp, don't do that, you're going to get cut. Or if you're doing an activity and you feel like your ankle's about to twist, cut it out because you're going to twist
your toe.
Right.
You know, even if it's slightly delayed, sometimes that pain
That's right.
sort of message
it
to your
tells
brain,
you
right?
not to do it again. And in patients with this condition, there's also concern that even if they developed appendicitis or as an adult had chest pain due to a heart attack,
Right.
you know, what sort of cues can they use to know that something is wrong? Because pain is not one that they have.
I didn't even think about that, internal pain,
Right.
and the dilemma that will pose for Ashlyn at some point, for her to say, I have a really bad stomach ache, or you know, something may be really wrong with me inside. There's no way of her really even feeling that way and being able to express it, right?
Well, the one good thing is that she's not completely numb. So she can feel certain things. She can feel light touch, she can feel pressure, she can feel mild changes in temperature. So what doctors would do is encourage Ashlyn to use other sensations, like pressure, for example.
How many people are affected with Ashlyn's condition?
Only about 1 to 2 dozen in the United States.
And are scientists and doctors learning more about this condition?
They are, in fact. One interesting thing that they're looking at is empathy, because a lot of us develop empathy as children because we see a kid fall off the swing and they cry, and we feel for that child because we've fallen off the swing and we know how unpleasant that is. You know, one of the questions is, do patients with this condition have that same ability to feel empathy?
Do you ever cry, Ashlyn? Maybe not from physical things, but when you see a sad movie, I mean, emotionally, Ashlyn has the capacity to feel emotional pain, just not physical pain, right?
Yeah.
Correct. I mean, she cried when her doggie got lost, and she cries, you know, if she gets upset. I mean, she clearly has feelings along that way.
You have been working with a camp, I understand. It's called Twin Lakes. It's a camp for kids with special needs, right?
Correct. Our camp, we actually, Ashlyn had a dream about 2 years ago that we started a camp for families like ours, and I knew in just a split second that, you know, we were going to do it. And it was a long process, but we founded Camp Painless but Hopeful, and it is a family-oriented camp. So the condition affects the whole family, our daily lives, how we live, and we wanted to unite everybody, because for the longest time we were told, you know, there's not many out there, you're the only ones, and we just truly knew that wasn't the case. I mean, there had to be other families.
And this is something Ashlyn really wanted to do.
Yes.
So I think that's proof positive, Ashlyn, that you are an empathetic person.
Absolutely.
And you care about other children and other families like yours as well. Well, we want you all to be able to continue the good work you're doing. So Band-Aid is actually teaming up with Camp Twin Lakes, and not only will all the families be attending camp for free this year, they're also purchasing instruments as well as equipment for the new Blockers Band-Aid band room that all the kids at camp can enjoy. And I guess form a band. Which would be nice. And the nice thing is, it's going to be named after your family, so it's really an honor not only of you, but an honor of your parents as well, and all the challenges that you all have faced as a family. So that's a nice thing that Band-Aid was able to do. Anyway, well, listen, continued good luck in your journey with this, and I'm so happy that you all came in. I'm so sorry, Ashlyn, that I've made you cry now.
Happy tears.
Happy tears. I'm happy to hear that. And Mallika, thank you for coming in and giving us some insight into Ashlyn's really very mysterious condition, and I think it makes us all appreciate what you have to go through every single day in helping keep your daughter safe. So thank you all for coming in today. We really appreciate it. Ashlyn, especially thank you to you, because I know you were kind of nervous about doing this. It wasn't so bad, was it?
No.
Okay, good.